I'm Rob Hobson, registered nutritionist and nutritionist at Healthspan, and I'm joined here today by Dr. Hilary, and we're going to be talking about statins today. We've got a nice stat that 2.5 million people are on statins in the UK. So can you explain why
it's
people
the
take statins?
most commonly prescribed drug in the UK, Rob. I mean, it's got enormous popularity and it's very overprescribed sometimes, people would say, by doctors, because it has a number of uses. The commonest use is for reducing unhealthy levels of bad cholesterol, which can predispose to heart attacks and strokes. But it also boasts a reduction in immune function. So for people with multiple sclerosis, it has its benefits. It is thought to reduce the risks long-term of dementia. And it's also thought to reduce the risks of strokes as well. So you can understand why it's very commonly prescribed.
Okay, and what are statins? How do they work?
It's a medication which produces an effect on the liver so that less of the bad cholesterol is manufactured there. We get a lot of our cholesterol from our diet, but most of it is produced in the liver. So genetically, some people are predetermined to make more cholesterol than others. So high cholesterol levels has a correlation to increased risk of heart disease, and statins are drugs which reduce the production of cholesterol.
Okay, and you mentioned cholesterol earlier, so there's different types of cholesterol that we have?
Yes, cholesterol is made up of, broadly, of LDL, low density lipoprotein, and HDL, high density lipoprotein. In short, one's known as bad cholesterol because it furs up the arteries and clogs arteries. The other is known as good cholesterol because it takes the bad cholesterol away from the lining of arteries back to the liver where it can be processed. So what you want is, you want less of the LDL, more of the HDL, and that's what statins can do.
Okay, and in terms of when somebody would be prescribed a statin, when would you personally recommend that someone take a statin?
Anybody at higher risk of having heart disease or circulatory problems in the future. So if you use a chart to determine someone's risk, and if their risk in the next 10 years is, say, 20% higher than average, based on their age, their gender, whether they smoke, their blood pressure, their cholesterol level, and whether they've got diabetes, you would say anybody with a risk of 20% or more would be eligible for consideration of a statin medication.
Okay. And you mentioned some other factors there, smoking. Is there anything else that somebody can do to protect their heart if they're on statins?
Good question. The first thing people should do is adopt a healthier lifestyle. I mean, if you exercise regularly, if your diet is healthy, if you don't smoke, if you avoid stress as much as possible, if you manage any diabetes as effectively as possible, you're reducing your risk. So those are the things you can do first for yourself. But in those people whose lifestyle adjustments don't reduce their cholesterol to satisfactory levels, then statins are worth considering.
Yeah, okay. And you mentioned diet earlier. So obviously we've got some foods here as well. We know that soy is actually quite useful for reducing cholesterol, and also fibre, particularly the fibre that we get in oats, oat beta-glucans, and just an overall balanced diet as well to try and sort of manage your weight.
It's important, absolutely. We know that it's saturated fat in the diet which is converted in the body to unhealthy cholesterol, which is so damaging. But a healthy diet, if you're eating lots of fibre, it clings on to dietary cholesterol and the cholesterol from bile acids secreted by the liver, and that reduces further absorption from the gut. So healthy diet, not smoking, plenty of exercise, all good things. The trouble with statins is that they have side effects.
Yes, I've heard about those.
You know, about at least 2% of people taking statins will get side effects, particularly muscle pain and joint pain, amongst other things, headaches, sometimes tummy upsets. They're rarer, but certainly muscle pain. And the reason for that is because when you block the production of cholesterol, you block the production of a healthy, naturally occurring enzyme called coenzyme Q10. And coenzyme Q10 fuels the energy production in every cell of the body. And without it, or when it's reduced, you get muscle pain. So my recommendation is that people taking a statin who do get some muscle pain should consider taking ubiquinol, which is the active ingredient of coenzyme Q10. So you can take that as a supplement. It's called ubiquinol, and what it does is it boosts the levels of coenzyme Q10, which are otherwise reduced by taking the statin, reduces the muscle pain that sometimes people get.
Okay, and of course the other supplement people often take is the soy isoflavones.
Yep.
From soy milk and other soy products.
Absolutely, yeah. That's, I mean, you can get that naturally from any soy product, from tofu, from soy milk, from soybean products. And omega-3 is really important as well. Omega-3 essential fatty acids, which you can get from oily fish,
Yeah, we've
like
got some
salmon,
adapters here.
tuna,
Yep.
herring, sardines, those sort of things. Omega-3 is really interesting because it is a naturally occurring product, but we know that it has an anti-inflammatory effect on blood vessels. We know that it reduces triglycerides, which have a similar effect to cholesterol on heart disease. We know that it can have an effect on blood clotting to prevent blood clotting occurring. And if you've got an irregular heartbeat, it can stabilise an irregular heartbeat. So omega-3 is a really good naturally occurring product to consider if, you want to reduce your heart risk without side effects.
Okay. And if you don't eat oily fish, then we could recommend a supplement of omega-3?
Certainly omega-3 supplements, yeah, well worth having. Yeah.
Great. All right. Thanks, Dr. Hilary. And if
Thanks,
people
Rob.
want more information, where can they go to
I
find
think
that?
there's some excellent sources. If you go to NHS Choices on the web, or there's the Family Heart Association, there's the British Heart Foundation, all good sources of extra help.
Right. Okay. Thanks.
Thanks, Rob.